Our next paper comes to us from Penn State. It's titled A Pilot Functional MRI Study in Roux Gastric Bypass Patients to Study Alteration in Taste Functions After Surgery, and it's being presented by Dr. Ann Rogers.
Thank you. Now for something completely different. So this project was funded by a 2011 SAGES research grant. I really appreciate that. I'm also a consultant for Apollo Endosurgery. So gastric bypass is an effective procedure. We don't completely understand all the ways in which it works. Among other things, there are changes in taste and smell and food preference afterwards. So we wanted to look at changes in perception and reward from food. We knew that we would pick up on these things based on prior animal and human studies. We have a rodent model of gastric bypass, and we know that there is decreased brain activation in reward areas, particularly in response to sweet solutions. So we thought that there would be findings in sweet solutions, but not salty. And we also thought that patients would subjectively rate things differently and express aversion to high sweet solutions. We had IRB approval to recruit adults who were scheduled for gastric bypass. There were exclusions: contraindication to MRI, inability to read, believe it or not, and the use of hypoglycemics, antidepressants, and anxiolytics. And of course, patients had to be able to fit into the bore of the magnet because this was an fMRI study, and our magnet bore is 188 centimeters diameter. So this ruled out our ability to use super obese patients. So we plan to scan patients preoperatively, then at 1 month and 1 year postoperatively. And along with that, patients were exposed to a variety of sweet and salty taste solutions at different concentrations. We did have some healthy controls as well. We had a lot of limitations to recruitment. We had many patients who just were ruled out from being able to undergo MRI. Many patients didn't want to take the time to do additional studies and lose time from work. We had a chintzy gift card that we gave to patients at each scan. I think that limited our ability to recruit. There were many patients who were afraid of being exposed to X-ray, even though we explained this was not ionizing radiation. Many patients had had prior MRIs, and they were very anxious about getting involved in such a thing. And then we had patients who enrolled and dropped out because they found that they were anxious in the magnet. And of course, a huge number of patients not only were too large for the magnet, but were ruled out on the basis of medication use. Ultimately, we recruited 15 subjects. At the very first day, 2 of them dropped out because of anxiety in the magnet. So we did have 13 patients who were able to complete the taste tests and go through the scanning. Mean age 46, mean BMI 43. And also their ability to rate intensity and perception of taste was deemed to be within the normal range based on prior healthy volunteer studies. So of all those patients, exactly 5 of them completed our entire protocol from start to finish a year after surgery, only 5. We also had 7 controls. They were overweight, not obese, and they went through a process where they did the taste ratings and an MRI, and then they came back a month later and did the same thing. We actually created a gustotometer. It was programmable to randomly deliver different concentrations of sweet and salty solutions, and then we had artificial saliva, yuck, but you don't taste it, to cleanse the palate between runs. This is the gustotometer. This is a schematic setup of the machinery. The little bags of tastants are hooked up by tubing to the back of the gustotometer, and then there is outflow that delivers solutions to the mouthpiece of the patient. These are the real tubings. Okay, here's the setup of a patient in the machine. They're locked into a headpiece. They have a mouthpiece in their mouth, and different tubes are hooked up to the mouthpiece. So you got to figure, this is a special person who's willing to do it not just once, but 3 times. Okay, this is an example of our taste stimulation paradigm. Patients would get cues, taste something, rate it in terms of intensity and pleasantness, swallow, rinse, and then after each tasting evaluation, patients would undergo scanning. This shows some of the cues in the back of the magnet. These were reflected onto a mirror that patients could see on their facepiece that told them what to do and what to expect. These were handheld devices that we taught patients how to use to help them rate intensity and pleasantness of solutions while they were in the magnet. And so after each taste run and evaluation, we would then acquire scanning, and we had computerized cuts that would show activation in areas of the brain that were of interest to us. So we did in fact find activation in the brain, both in the sensory areas and in the reward areas. This is what we expected. And we were super excited because at the 1 month point after gastric bypass surgery, we did see significantly decreased activation in the reward centers of the brain in response to sweet solutions. So we figured we were geniuses. This worked out just fine. Unfortunately, we found exactly the same thing in our controls. At 1 month later, they too had decreased activation in the reward centers in response to sweet tastes. And overall, patients did not report a significant difference in how things tasted to them, which surprised us. Now, unusual finding, in response to the salty solutions, our bypass patients actually had significantly increased reward in the reward centers of the brain in response to salty solutions. We hadn't expected that, and in fact, we did not see this change in our control patients, so that was something new. So yes, all of our gastric bypass patients did lose a significant amount of weight. Some of them did report changes in taste, but since we had such a low number of patients, this was not statistically significant. So all I can say is fMRI is a tool where you can pick up changes in the brain after gastric bypass surgery. In our particular study, we only saw changes in response to salty solutions. Subjective ratings, not significantly different between the patients, controls, and patients. And I believe some of the changes or lack thereof were really due to learning and habituation in the environment of testing. So confusing, but I can tell you some limitations. We had very few patients enrolled. It required subjective responses, and really we didn't have true controls. Those would have been obese patients who were losing weight at the same rate as gastric bypass patients and then tested. So we look forward to learning more about this. Thank you.
Questions from the audience? So you talked about differences preoperatively versus postoperatively in one individual. I'm interested in understanding what were the differences between individuals, pre-op, post-op. In other words, do you and I have similar responses to sweet and salt?
Yes.
And is that relevant, or should it really just be about you being compared to pre-op versus post-op?
Yes, that would have been best, but what we did was we collated all the results and made a combined ultimate scan that applied to all of the gastric bypass patients and all of the controls. So yes, there are probably individual differences, but it's hard to peel that apart.
No doubt. Question?
Chris Egan from St. Louis. Other studies have shown a difference in the taste for sweets after gastric bypass, and I'm sure you're aware of those studies. Did you test your gustotometer outside the environment of the MRI scanner? Maybe there was something about the MRI scanner that was altering the patient's feelings.
Boy, it's hard to tease that out, but yes, we had a number of volunteers who were testing it over and over again without being scanned, and that was more consistent. There's something about being in the magnet environment that mostly freaks people out and probably changes their results.
Well, I found your paper just fascinating because one of the first things I tell all my patients post-operatively when they start to say, you know, especially when they're on the liquid diet post-op, is that your tastes are going to change.
Mm-hmm.
And I kind of tell them, my personal theory was maybe it had something to do with the microbiome changes or things, but I think it's really interesting that there are actual MRI changes. What do you plan to do to take this research further? Because I think it's a very interesting topic.
I'd love to take it further. It's hard to get enough funding to have a significant mass of patients to really have it be meaningful. Yeah, I was particularly surprised by the salty business, but there are many blogs that show that there are some patients who seek out salty or salty and sour things afterwards. So we may have had more of those patients than the people who are more affected by sweets. It's fascinating.
Yeah, thank you for that nice paper.
Very
Thank
nice.
you.
Thank you.